What's going on, everybody? In this video, I wanted to talk to you about the difference in whether your symptoms have come on slowly or come on suddenly. And this discussion was prompted by a question I received. Um, she was asking, she was saying she had the same problem as I do, but in her left arm. She woke up one morning with severe pain in her elbow, into her arm, hands, and fingers. Wrist support helps take away the pain from the wrist, but when I'm not using it, the pain would be sharp. I can't do any exercise with it. It's been 4 months already. I think the pain is coming from the elbow, from the funny bone. If I hit my elbow or anything, it hurts. Well, let me try to go through this real quick. Anybody that hits their funny bone, that's going to hurt. So that doesn't necessarily mean you have any issue with your ulnar nerve. The fact that you have pain at your wrist, I don't hear of many people with the ulnar nerve entrapment at their wrist. I forget what the name of it's called, but there is a condition where you can get it compressed at your wrist. It seems a lot more rare than entrapment at your elbow. So that could be carpal tunnel. It depends on if you're getting numbness in your pinky and your ring finger, half of your ring finger, that's more cubital tunnel. If you're getting numbness and cubital tunnel is your ulnar nerve, funny bone. If you're getting numbness in your thumb, pointer, or middle finger, that's probably carpal tunnel. And the fact that you're talking about a wrist brace, there's not any wrist brace that I know of that will help with the ulnar nerve entrapment at the wrist. The only wrist brace I know is the one that'll kind of keep your wrist at sort of this position to help open up the carpal tunnel to alleviate some of that problem. So you could have both. You could have one. I very much encourage you to go see a doctor and try to see what's going on. It sounds like a lot of things are all over the board with you, but going back to the original part of your question, you said you woke up one morning with severe pain in your elbow and then up into your arm. I don't know if you're saying up into here, but then you mentioned the wrist. But anyway, let me just touch upon whether or not this kind of starts becoming something that you slowly deal with versus something you wake up with one morning or some incident and it happens. I would say it's much more urgent to go seek a doctor to pinpoint what's going on. If you woke up one morning or if one instance or circumstance happened and then you have this pain like that, or you have this numbness, that probably means that either there was some sort of traumatic injury to your ulnar nerve, you were playing sports or an accident or whatever, or if you slept wrong or you had your arm in a weird position wrong, that damage was so acute that now you have this issue. So it needs to be addressed quickly because it's probably not going to, all within reason. If it goes away within a couple of days, then obviously it's not a big deal. But if it's a couple of weeks and you're still dealing with this, I would highly encourage you to go see a doctor. I wouldn't even wait a couple months if you get a sudden onset of symptoms. Another thing that usually points to is that your compression symptoms are so severe at that point that, your nerve is really pissed off. You got a real good compression there. That usually points to compression. Subluxation is something where your nerve is popping back and forth over time, and it kind of gets to a point where it's probably been happening your whole life, and you just get to a certain age where it's like, all right, I've had enough of this, and then you start slowly getting numbness or pain. That kind of stuff you can try conservative treatments with the night brace and avoiding activities that irritate it. And I think it's a little safer to kind of self-diagnose and try to do those things before you go in to see the doctor. But if you have a sudden onset of symptoms, I highly encourage you to go see a doctor right away. Find a good hand surgeon that deals with carpal tunnel, cubital tunnel, and go in and see if they can help you figure out what's going on, because that's the key to getting any kind of relief, whether it's through conservative means or whether it's through surgical intervention. That's really the key, is understanding what exactly is going on in your particular case. So again, just to recap, if it comes on fast, give it a couple days. Sorry. And see if it goes away. If it doesn't, go see a good hand surgeon. If it comes on slowly, you can try to find ways to work around it and give it time. And then if it gets to a point down the road where it reaches a point where you know it's not getting any better, you've dealt with it for a while, it's interfering with your normal way of life, then it's very much time to go see a hand surgeon and get it taken care of. In fact, I would recommend seeing a hand surgeon before that, just so you exactly know what's going on, because more often than not, they're going to tell you, okay, Kolohe, that you need to sorry. They're going to give you conservative recommendations before surgery, usually 99% of the time. So anyway, I hope that helps. I hope all you guys are feeling better. If you have questions, keep them coming. I'm going to work through these and get them up faster. So I hope everyone's doing well. And until next time, aloha.